Hello and welcome to the CTM NewsBreak, where we keep you up to date on what's happening right here in town. I'm Diane Sherritt-Steimel. Well, the fight to find a coronavirus vaccine goes on amidst Massachusetts' rocky rollout. Lowell General Hospital is vaccinating 1,000 people a day, and they're still booked for a month. But hope is on the horizon with more types of vaccines, more doses of vaccine, and more masks on the way. CVS has added 17 additional locations in Massachusetts to its fleet of COVID vaccination sites. In the midst of this pandemic crisis that has caused job losses and economic suffering, officials have announced they're reopening enrollment for HealthCare.gov until May 15th. This is an important step to help those who have lost access to affordable health insurance and explore their options, and many will qualify for financial assistance to help pay for some or all of their monthly premiums. In other news, the opioid epidemic may have taken a back seat to the coronavirus pandemic in the public consciousness over the past year, but the crisis has deepened for those who have lost jobs, health insurance, and homes. Attorney General Maura Healey, along with a coalition of attorneys general, has announced a $573 million settlement with one of the world's largest consulting firms for their role in promoting opioids.
We know the opioid epidemic is one of the most devastating crises of our time. The rise in opioid prescriptions caused an equally devastating rise in substance use disorder, overdoses, and deaths. We continue to see it every day in our communities.
The settlement will fund the state's newly created Opioid Recovery and Remediation Fund to help expand access to opioid use prevention, intervention, treatment, and recovery options. And finally, what did you accomplish during the pandemic lockdown? One Parker Middle School 7th grade student published a very well-researched article about Mars. Many of us watched the landing of the Mars rover with excitement, but this 7th grader's put a lot of thought into what he thinks is a misguided effort.
Everyone's talking about these Mars missions, and everyone is happy about that, but nobody's talking about the COVID curve being flattened vertically.
He wrote a well-researched article where he says that people like Elon Musk are using scientists and resources to prioritize their own dreams and not what's best for humanity overall.
I haven't seen any article or anything on the web that justifies these missions over saving people's lives.
He even created his own illustrations.
We spent around 4 months on it, and I just did research. We used trusted websites like CDC and World Health Organization. It started some time back when COVID arrived in the United States. So we were just tracking the news, and we saw the number of cases and deaths rising rapidly. And then at the same time, I saw the news about SpaceX launching their Falcon 9 rocket and other advancements happening regarding the Mars mission. So I was like, how can this happen? Here we have many people dying, and then you're launching rockets. So everyone is preparing for this Mars colony where we will create a whole ecosystem on Mars. But how can we do that if we can't even keep ourselves safe from basic virus on Earth? We have been researching viruses for hundreds of years, and yet we haven't been able to stop it. We're not handling this pandemic much different than how we handled the Spanish flu almost a century ago. We're preparing for all sorts of wars against humans. We have nuclear weapons and all those things, but we can't save ourselves from a basic virus, the real enemy. Priorities are skewed. I'm not against all these space missions. I think they're really good, but we need to focus on the problems that need solving.
Thanks for watching the CTM NewsBreak, brought to you by Chelmsford Telemedia. If you have news we can use, contact us at newsbreak@chelmsfordtv.org. I'm Diane Sherritt-Steimel.